this was my identity.
Nobody talks about how freaking hard it is to be a dentist. What most people talk about is how this affects the patient. What nobody talks about is how this affects us. Dentistry is ready for this. Now is really the time. Welcome to Wellness in Dentistry. I am one of your co-hosts, Dr. Kyle Stanley. I'm a dentist, tech entrepreneur, speaker, and researcher, and I'm joined by my very good friend and your other co-host, Dr. Martin Mendelson. Martin is a disabled dentist, coach, speaker, thought leader, and author. And together, we've helped thousands of dental professionals pursue wellness in dentistry. And in just a few weeks, we're going to be giving a 2-day in-person live CE course in Irvine, California on May 9th and 10th. We call it Lightside Live. And it's really a transformational course. It's our favorite days of the year to speak. We get dentists from all over the world. I didn't tell you yesterday, Martin, that there's a dentist from Israel who's interested in coming.
Oh,
So,
fun.
yeah, so more people from around the world. And if you're interested in coming to this course, it is at Glidewell Dental Lab in Irvine. You're 20 minutes from Disneyland. You're 20 minutes from the best beaches in California, so you can make it a vacation if you'd like. Go to our website, wellnessindentistry.com, and click on links, and you'll find everything you need there. Now, today, we're going to discuss where Martin was this last week and some of the specific topics that come based on where he was. Now, he was at an event called Women in DSO, so all based around females in our profession, women in our profession. And so I'm excited to hear about this event and also maybe talk about some of the specific challenges that our female colleagues go through that Martin and I have learned from working with so many women docs around the world. So Martin, tell me about it. How was it?
That was fantastic. It's actually my second time attending the event. And, this is a group started by Dr. Aman, and it's just kind of grown and grown and grown. It's my understanding that kind of the initial thoughts kind of were an offshoot of DICMA, the DICMA DSO meeting. And so
Mhm.
there's a lot of cross-pollination and support from one group to the next, which is great. They had over 1,000 people there. It was at Caesar's
Wow.
Palace in Las Vegas. And, interestingly enough, there were some companies there that very large, major companies that weren't even in the exhibit hall at some other major regular, shall we say, or longer standing dental meeting. So, when you think about the numbers of women, particularly in DSOs, you have CEOs of all the major DSOs have either attended in the past or attended this year, and the numbers are quite staggering in terms of the percentage of women that are working within these organizations. Forget about 50-50. It's more like 80-20 or 90-10 women
Now, are
versus
you talking
men.
about that from the business side, or are you talking about that
No.
from the
Total
the
number of employees, team,
so that's
clinical team. Yeah,
including doctors as well?
yeah, 100%, 100%.
Yeah, I mean that's a big deal. Right now everybody knows around the world that there's more female doctors going through dental
Mhm.
school
Yep.
than there ever has been.
Hmm.
In some countries it's 70%
Hmm.
are female.
Absolutely.
When my dad graduated in 76, I think he said he had one or two maybe.
Hmm.
And he's talked about this before, just the horror that they had to go through.
Oh, it was horrific. I mean,
He
just
said they would come up and say, hi, Dr. Smith, can you look at my wax up? And the doctor would just ignore them, turn around and walk away.
yep. Yeah. I saw it firsthand actually. So I went to the University of Maryland and I did a GPR at shock trauma. And at the time, I think it's still the case, the GPR residents, shared the same clinic as the oral maxillofacial surgery residents. And there was a woman resident in that class on the oral surgery side. It was a really good friend of mine. And I was a firsthand witness of the misogyny and just the horrific treatment that she had to deal with that the male colleagues didn't have to. And it was really made an impression upon me relative to just how, forget about inappropriate, just unbelievable. So the way some of these women have been treated over the years.
Yeah, and I want to make a distinction. Martin and I are guys,
Yeah.
and we could never fully
No,
understand what our female colleagues go through.
no.
However, because of the doctors that we've worked with, they've actually informed us,
Yeah.
given us their experiences, and asked
Mhm.
us to share this.
Oh,
I
absolutely.
even added a part in my triggers course called
Mhm.
gender differences.
Yeah.
And Martin and I did an entire course, our Light Side Live course, with an all female group in
Yep.
Milwaukee, which was really cool. And we learned a lot. I think they learned a lot too.
Mhm.
So just understand the caveat that we are coming at this not trying to mansplain to anybody, but
Yeah.
more to bring light to a situation that, to be honest with you, many female doctors have told us they don't want to bring up because it's perceived as complaining.
Yes.
So I know when I first did a post, I don't know, a year and a half ago or something about this, and it went crazy. It was one of my
Mhm.
biggest posts I've ever done. And I had so many people message me and say, "Thank you for doing that. I think it needed to come from a man because
Yeah.
if it came from us, it looks like, oh, boo-hoo, we're complaining." And I never even thought of that.
No. No, because I mean, it's real, it exists, and it's horrific. And so it's like, how can you even think to accuse somebody of complaining when the reality is just so completely ridiculous?
Right.
Another friend of mine from dental school, she, ironically enough, also became an oral surgeon, and she would go to Amos and other surgical meetings with her husband that happened to be an orthodontist. And so they would use these meetings, as many of us do, as an opportunity to have a little vacation. So she would go to the ortho meetings and vice versa. And they made this was the way they described it to me, that after going through the shock, they ended up making it a game that they would be in the exhibit hall at, for example, Amos. She would walk up, ask a very specific surgical based question, and the rep, male and female, by the way, would then look at him, her husband, and answer him and ask him questions. And the game element of it became, they started to do this on purpose to see what the reaction would be. And then when the sales rep would do that behavior, they'd look at the sales rep and say, you know what, you just lost a sale because I'm the one that asked the question. I'm the surgeon and you decided to answer him.
That's
And
right.
so it's not just within the clinician ranks, it's also within the sales team ranks as well.
Yeah. So tell me more about the event. So it's called Women in DSO.
Yeah.
Is it all DSO based?
Well, so many of the women that are there are actually in corporate positions. And so you had a senior executive from Dentsply, senior executive from Spear, senior executives at Pearl,
Yeah.
all kinds of different Overjet, a lady actually did a panel or facilitated a panel. I was trying to find the word.
Yeah, their CEO is
Um,
female.
yeah.
Mhm.
And so and many men attend the meeting. I'm a full member of the organization. I pay dues like everybody else because I want to support it. But it's similar to some other meetings where it is majoritively main stage. They did have some pre-event workshops on, I guess that would have been Thursday morning. It starts off with a cocktail hour reception, and then begins in earnest Friday all day. They had a fascinating keynote executive from Google who was talking all about AI, and she was a fantastic speaker
Mm.
as well. And so it's mostly focused on, you know, women in DSO, women in leadership positions, overcoming those challenges. Yes, specific kind of to the DSO space, but there was also two women that were up there, one of which was ironically enough an oral surgeon telling similar stories to the ones that I just shared. And so it is about state of the industry. It is about new technologies. It is about marketing and sales and no clinical content.
Mhm.
But it's also about empowerment and networking and supporting each other. And then on, I think it was Saturday, there's a host of awards that are given out for women in influential positions that have done, various things for the profession and for others in mentorship. So it's a really great event that is also a fun event. The food was great. The venue was great. It was a great experience. So,
Yeah, I'd like to share some quotes from some of the people that have taken our courses that have talked to us about, from a female doctor standpoint.
hmm
They they come into the room and, a new patient says, "Are you the doctor?"
yeah,
Or "Is the doctor coming in soon?"
yeah,
Or even things like, "Are you studying to be a dentist?"
yeah, yeah,
We had someone who took our course that told us a patient said to her, "I'm not here for a cleaning. Is the doctor coming?"
yeah. For those that know my background, I started in dentistry at 16 as a dental assistant. And I would assist this female dentist. She was fantastic, actually. And I look back at pictures of me when I was 16 and I look 16. In fact, maybe I look younger. And do you know how many times I would bring a patient back and and she would walk in and they'd look at me in front of her and ask me if I was the doctor. Like it's insane the misogyny that goes on in the world.
It's funny that happened to me too when I was an oral surgery assistant. I was a little older, I was
Yeah.
22, but
Still.
I didn't look very old. I looked young. I looked pretty young. I didn't have a beard or anything like that, even at like 22.
Yeah.
And I would have people ask me, "Are you the doctor too?" And we had a male doctor. One
Yeah.
thing that came up recently, I think I was talking to someone on Instagram or they were commenting on my post or something, is they were talking about patients asking them who's watching your kids,
Hmm.
which
Interesting.
was really interesting, right? Because no one asked me that.
No.
No one's ever asked me who's watching your kids,
Yeah.
right?
Yeah.
They assume that either I have a spouse or that I have a nanny or something, but when it's a female doctor, it's crazy that someone would say that.
Well, the other thing that you and I have both heard is that people will ask women, dentists, do you have kids? Or when are you going to have kids? And we were both present on one of the Lightside groups on Lightside Club that meets every
Mhm.
third Friday. We're present when this female dentist was sharing how difficult that was for her because of certain decisions and certain health realities of her own life, and how people just don't understand the gravity of the question that they're asking because
Mhm.
of the life reality that may be behind the situation itself.
Well, that's one of the things that we men could never understand. And
Correct.
that's why I think being a female doctor is more challenging. And
hmm
that it happens to do with just age. It's
Yeah.
like if you go to dental school, if you go to college, let's say in the US or North America, you go to college, you graduate around 22. If you get in dental school right away, you graduate around 26,
hmm
27. Usually at that point you're doing maybe a residency or
hmm
maybe you're doing an internship or something specialty
Yep.
even, and you get out and then you're working as an associate for a few years. And then maybe you start buy a practice, and then you're like, oh my gosh, I really have to work hard now.
hmm
I mean, it can be to the point of where you're 38,
hmm
and then you say, well, maybe I'm going to try to have kids now, if
Yep.
they want kids, right?
Right.
And you and I both know a lot of female doctors that have had challenges having
hmm
children, but they have this dilemma where they're like, I've put so much time and effort and money into my profession
Yep.
that I need to give to that, but
Yep.
also I may want to do this family thing and I need to give to that. And at that point, they're at this crossroads where when they're in their practice, they feel guilty, and when they're outside of their
hmm
practice, they feel guilty.
Yeah.
And they can never really get behind that and get unstuck with that. And you and I help
Mhm.
them with a lot of those feelings. But that's something that we men don't have to think about. We can
Yep.
wait until we're 50 years old and have children if we want to.
Yeah. No, it's something that, for the men on here that are listening, if you've never thought about this before, I'd invite you to do so. Because there's a great weight, whether you want to have children and you have none, or you have one and you want to have two. It's all different sides of the same coin. And, we as men can never understand what that's like. And so we have to go out of our way to, at the very least, be supportive and be allies in their journey, and support them in whatever way they need, particularly if they happen to be our practice partners, or what have you.
Yeah, another thing that's been brought up to me is this idea of career momentum with
Hmm.
motherhood.
Hmm.
So let's say that same example, we do have a dentist and she decides to have children, whatever age
Hmm.
she is, and she has a child. And great. But then she's taking 3 months off, 6 months off,
Yeah.
9 months off, whatever she takes off. And so she has this career slump. And
Yeah.
then maybe she builds it back up a few years later, and then maybe she has another child and has this career
Hmm.
slump. So a lot of our female colleagues have told us that they always feel behind.
Hmm.
Like their male colleagues, like when I had my first child, I took 2 weeks off. Now,
Yeah.
in retrospect, I should have taken more time off, but
Sure.
I had the ability to just go back to work. Like it was
Right.
super
Right.
easy
Right.
for me. And I didn't have to take time off and bond with the baby and this kind of thing and deal with breastfeeding and all the challenges and changes in your body. And I
Hmm.
mean, practicing, we've talked about how physically challenging practicing enough is. Imagine now having 30 more pounds right in
Yep.
front of you,
Yep.
as you're curled over these patients. And you and I both know many of our colleagues who have practiced until eight
Oh
months.
yeah.
I mean,
Oh
how
yeah. Yeah.
difficult that must be.
Ugh. Yeah. I can't even imagine.
It's just something, it's the reason why we bring it up is because no one's talking about it.
Yeah.
And we would rather have the arrows thrown at us
Yeah.
than have it thrown at our female colleagues,
Yep.
you know?
100%.
I mean, what are some things that we learned at our course in Milwaukee that maybe stood out to you?
I think immediately when you asked that question, before you even finished it, it was that you just don't know what some people have been through. Because particularly in Milwaukee, without going into any details, there were several just really gut-wrenching stories of resilience and perseverance and homelessness and all kinds of things that you never would have known. And, the individual admitted that this is something that they never talk about. And
Yeah.
so you just, and this goes for anybody, women or men, you just don't know what somebody's life has been like. And so to be kind, or even just to simply not sit in judgment and be curious about a colleague's actions, inactions, or the way, shall we say, that they are and they interact with others. And instead of sitting and judging people, what would it be like if we were just simply more curious about, I wonder why they acted, reacted, or said what it is they did? Because we don't know, and we don't know what's going on behind, shall we say, closed doors, as the phrase goes.
Yeah, it's so true. I think we dentists, we're buttoned up generally, at
Mhm.
least on the outside, right? Um, we look put together most of the time. We
Most of the
we
time.
most of the time, right? We arrive to work and we're a doctor and we're
Mhm.
business owners or we're associates or we're well educated, we make pretty good money,
Yep.
but we're people
Mhm.
underneath this all,
Yeah.
right? We're people that lose family members, that go through
Mhm.
addiction, that go through depression and
Yeah.
anxiety, that lose children, that have failed businesses, have failed marriages.
Mhm.
And on top of that, our job is challenging, and there's
Yeah.
many jobs that are challenging.
Yeah.
But remembering that we're humans, I think is something that we need to give even ourselves grace
Yeah.
on that.
Yeah, I couldn't agree with that more. I mean, just this week, a fellow dentist was telling me about their father that's going to a hospice, and this person practices full time, and their mom is still alive, and so she's a mess, and like you just don't know what these people are going through, and just the ability for them to, as the phrase goes, pull themselves together and be there for other human beings that are called patients is really quite extraordinary if you think about it. Because we've talked about this before, and it's never stated in disrespect to our medical surgical colleagues. And certainly operating on a tooth is not the same as operating on a heart. So let's just call it what it is. But by the same token, what we do is 8 hours a day for 3 to 5 days a week. What they do is, 3 to 10 hours a day, 1 to 2 days a week. And so, from a physical perspective, from a mental perspective of needing to be there for the patients, it is different. And it is in many situations, not all, more significant than our medical colleagues. And so it's something to be understood, respected, and thought about as we interact with others in this world.
I'm curious, at Women DSO, did they give any advice or ways to move the profession forward on the corporate side, on the clinical side? Like, did they go into that at all?
Tell me more about the nature of your question. What do you mean by
The
that?
nature of my question is, this group was formed to elevate women in our
Hmm.
profession, whether
Hmm.
it's on the clinical side or non-clinical
Hmm.
side, and give equal opportunity
Yep.
and, support any challenges they may need.
Mhm.
Did they talk about moving the profession forward, and did they give any advice or things that need to change?
Yeah, I think that it was implied both explicitly and implicitly. And so there was a lot of individuals there because they did a lot of panels, which are kind of cool. And so, you have these powerhouse women that are, CEOs or, chief clinical officers or CMOs that are all there talking about their own personal challenges and how they overcame. And so there was a lot of empowerment through story and empowerment through
Okay.
experience and resilience that was communicated, as well as the concept of sticking together, which makes perfect sense during the meeting. But and I will say though that being said, it was a very inclusive conversation. It wasn't stick with women and women only. It was quite the opposite of that. It was like we need to support each other within this great big world of ours because we do have these specific challenges and we do have hurdles that we have to overcome. But that doesn't mean we need to kind of bang on society or another gender as well.
I like what you said there, which is like support each other,
Hmm.
because you and I have both heard, and I can think of one specific example of within the dental office, a lot of
Hmm.
female doctors feel like they're less supported by their female colleagues, and by colleagues, I mean like team members,
Sure.
than the male colleagues.
Yeah. Yeah.
Like their male colleagues, many, many times, or male team members
Hmm.
may support them more. And I'm wondering why that is. Because I've heard a theme of that. But it's
Yeah.
like, is it because they're seen as competition? Is it just the fact that they haven't had a female boss before? And so this is just a different nuance to them.
Well, I think it goes to the double standard of how people interact with male versus women leaders. And, there's a lot to, if a male leader is self-confident and sticks up for what he wants, he's considered a leader. If a woman does the same thing, some people would call her a bitch. And it's a ridiculous double standard. And to some degree, that plays a very large part into that dynamic.
Yeah. I was thinking about the other day, um, the difference between, and this has nothing to do with female versus male doctors, but the difference of the challenges of dentistry that we have that come with the physical challenges.
Hmm.
But really, I think it's the emotional challenges of working on people
Hmm.
that in a very sensitive, hard to reach area.
Yeah.
And I was talking to somebody and they said, Kyle, but you're a people person. And I said, I am a people person, but I think being a people person and working with dental patients
Hmm.
is a different story.
Yeah, I would agree with that. Yeah.
And it's
Yeah.
like once you interact with someone at that level where you're 3 inches away from them, where you're, touching a very sensitive part, it's going to be uncomfortable. They may even have
Hmm.
some pain. They don't want to be there. That's when a lot of emotions come out
Hmm.
from patients, right?
Yeah.
And that's when I think patients can say things that they may not even realize are hurtful, harmful, offensive.
100%. Yeah. I mean, you were talking about that. I think to me, there's a difference between being a people person and being a good communicator. Because if you're a people person and you're not necessarily a great communicator, then in the clinical realm, you're going to really run into trouble. So a people person to me would be somebody that, has good energy and maybe is even humorous and, they inspire people to be chatty about X, Y, Z, but then therefore being able to communicate the ins and outs of the clinical experience, the treatment plan, informed consent, even in terms of what may happen. That dives into, I think, an additive skill set that may be separate from just being a good guy or a good woman that everybody likes and likes to be around.
I love that. And that really incorporates who I was, I think.
Hmm.
I was a people person that wasn't a good communicator.
Yeah. Yeah.
So in dental school, I was friendly, had a lot of friends. I could sit down and talk to anybody. And I thought that that would take me really far in dentistry. And I think what it was, I didn't have the communication skills.
Mm. And
And
I
then it
also,
frustrated me because I thought I was good with people.
yeah. And I also wonder too, is it that we don't have good communication skills, period? Or is it that we don't have the skills to deal with situations when they get dicey?
I think
Because
it was both for me.
yeah, because if you think about it, like even if you look at the neuroscience of it, when you're chill and you're calm, that's when it's a lot easier to be even keeled and have, deeper, fun conversations, right? But when, the poop hits the fan and your amygdala takes over, that's when we can get tunnel vision and fight or flight and all that other stuff comes in. And if you don't have the skills, then the emotions take over and then you end up having trouble. And, I think that even leads to another misconception, that women are more emotional than men. Well, something I'd never thought about before until this moment, I think what these people are wrongingly claiming is an interpretation of emotion. And what I mean by that is you say women are more emotional than men. The perception is that they're upset more easily, or maybe they get teary-eyed for some. Whereas men, they get angry and there's an outburst. That's not considered emotional. Like what a load of crap that is.
Yeah.
Have you ever, I mean, think about it. I haven't thought about it in those terms before, but I think there's some truth to that.
Yeah. I love
And
what you
again,
said.
another double standard.
I love what you said about if you're in the right headspace, it's easier to be a good communicator.
Yeah.
And so imagine everybody listening if they did both.
Yeah.
They could practice how to be in a good
Yeah.
headspace, aka
Yeah.
living between the stimulus and the response,
Yeah.
and learn all the frameworks and
Yeah.
communication standards
Yeah.
that help you and I in our communication. I mean, I know I was just talking to my brother last week. He was kind of having a hard week, and he's not my brother in dentistry.
Yeah.
And I was talking to him about crucial conversations. He needed to have a crucial conversation with somebody, and I
Mhm.
went over the framework with him on the phone. Probably start with this, start with facts, and I do, I don't. This is something we teach on our Light Side Live course, and it was funny how he called me because of my work in dentistry, and
Yeah,
also
yeah.
just because I'm his brother and I think I can relate to him well. But I also think that he and me and almost everybody could get better at
Hmm.
controlling our emotions and even just
Hmm.
knowing
Hmm.
that you can control your emotion.
So I texted you this yesterday, but I'd like to share something that happened on my way home last night. So I was with Don Anderson. For those that read Dental Economics, I did an article about him that's coming out this month. It's probably out already by the time this hits our podcast channel. And so I was working with his team. It was a great day. I had flown up 24 hours prior on the same type of aircraft, a regional jet, an Embraer, one of my favorite aircraft, by the way. And I have a specific bag that fits in the overhead of an Embraer jet. Did so on the way there, just like I always did, no problem. I'm the first one onto the plane because I got upgraded. And
Oh, nice.
the flight attendant says, "Sir, you're going to have to check that." And I said, "Oh, we're good. It fits in the overhead." And he says, "All roller bags have to be checked." And I looked at him and I said, "Oh, why is that?" He said, "It's our policy that all roller bags are checked." And I looked at him and I said, "That's interesting. I flew in 24 hours ago from Phoenix. I bought this bag to fit in the overhead of this aircraft. I don't want you to think I'm giving you a hard time, but this is literally what I said. But I
Yeah.
want you to understand I'm a little bit confused. What changed from 24 hours ago?" And he said, "All roller bags have been checked." And I said, "Sir, I would like to understand why." And he looks at me, and by the way, a woman behind me told me later she was chuckling the minute this happened. He goes, "Are you seated in first class?" "Yes." "Well, I'll make an exception this time and I'll put it in the closet. But just so you know," and I'm thinking, this is a policy you're making up, dude. But my point in even telling this story was that I was tired. I wanted
Hmm.
to get home. I didn't want to wait the extra whatever to retrieve my bag. But I also, and this is a but, not an and. No, it is an and. And I also was telling myself, do not get emotional out of this because if you can stay calmer, you're going to be able to navigate through this more effectively. And, and it wasn't about like winning or whatever. I was just perturbed emotionally that he was making stuff up that I knew he was making up. Right. And so, this even goes, we talked about this guy the other day, Jackson. Do you remember his last name? The Instagram guy, the lawyer.
Oh, the lawyer. I don't remember his
Yeah.
last name, but yeah, thanks for sending that to
He's
me.
fantastic about these kind of situations. And going back to the topic we're talking about today about ill treatment, and when people make some pretty uncomfortable statements, just simply looking at them, repeating the statement, and then following with, what was your intent in sharing that with me in that way? Like, holy smokes, right?
Well, I like how, I mean, you stayed calm even though you were tired, because that was what
Yeah,
stood out to me.
yeah,
And at my burnout point, I wasn't taking care of myself. I wasn't sleeping well. I learned that I had sleep apnea.
hmm,
And so it was much harder
yeah,
to to get out of my amygdala because I
hmm,
was in such a poor state,
yeah,
which goes back to we've talked about this on previous episodes, is taking care of yourself and showing up in the
yeah,
best way so
correct,
that you can live between that
right,
stimulus and the response. And so
right,
imagine this, I'm going to add even one more thing to it. If you are healthy enough and show up to, let's say, the dental office,
hmm,
which
hmm,
is can be a stressful situation, and you're aware of your emotions enough, you have
hmm,
the self-awareness and
yep,
understand that you can choose how you react,
yep,
and you have the communication skills. I mean,
yeah,
these are the dentists that thrive.
yeah, absolutely. And honestly, was I peeved at the situation even after it ended? Yeah. But did I feel proud of how I handled it, regardless of how the outcome would have shaken out? Yeah, I was. And by the way, while I was sitting there before we took off, I was texting my airline friends, and they're like, "Yeah, that's a load of hooey. back east on this airline and this airline, that is a policy, but he's full of poop. And I was like, mm-hmm, I knew that. But it's it's a really cool place to be able to get to where you can keep your emotions in check because you really and truly operate in a different place on a different level. And it's unfortunate that our women colleagues are faced with these kind of situations constantly.
Mm.
And it's not just from men either, as you pointed out. It's also from other women. It's from, subordinates in a dental practice where they have to be, as good, if not better than their male colleagues to be able to be successful, however they define that. And it's unfortunate.
That's an interesting point. I think that just underlines the importance of especially our female colleagues. I mean, of course, men too, but especially our female colleagues to have some type of mental health training, have
Mhm.
the self-awareness to know that
Yeah,
you can understand that you can
yeah,
pick your responses,
yeah,
have the communication skills, have the leadership skills, because they're going to be put into more challenging situations than
yeah.
we men.
And I do want to say something else. Like, you often say, and I agree, nobody understands a dentist like another dentist. And so with the topic today, you could extrapolate, nobody understands a woman dentist like another woman dentist. And for those women that are listening that disagree with us, because I've run into this quite a number of times, there's quite a number of women out there that don't believe that women-only organizations or organizations skewed toward women is even a good thing. They think
Mm,
that, they're the way it was told to me once recently. I think it was actually a female oral surgeon that I was talking to at the Seattle Study Club Symposium. Her slant was, she's like, listen, this is the reality of our world. And so, in her opinion, why would I want to sequester myself away when I have to function with these other people? I would rather sink or swim in that sea than hang around with other people. And look, it's her own journey. I'm not going to argue with her, right? And I'm not saying I agree or disagree. It just is, it's another take on the topic for today.
yeah, I could see my mom saying that actually. I could see
Yeah.
my mom saying like, let's thrive in the current situation instead
Mhm.
of creating
Yeah.
our own way. And I
Hmm.
think it can be argued either way for sure.
Yeah. Yeah.
And, Martin and I, again, will never truly know. We can attempt to understand and have
Mhm.
empathy and sympathy for our female colleagues, but really all of our information that we get, comes from being a dentist, right? We have that in common. But
Yeah.
all the additional challenges that our female colleagues may go through, we'll never
Hmm.
truly understand. But
Yeah.
we want to be here as advocates supporting our female colleagues. I mean, when you look at the numbers, women dentists are the future of dentistry.
Oh,
So, I
100%.
mean, we
And
we we have to support this.
yeah, and for those that are unaware, not only are they future on the clinical side, they're the future on the corporate side.
Yep.
There's a significant number of women in senior leadership positions in dental corporations, DSOs, larger group practices, et cetera, which is a great thing. And so it's something that not only needs to be embraced, but it's something that needs to be better understood, particularly by men in dentistry.
Yeah, right. So, what are some final thoughts you have for today?
Um, I really enjoyed my time in Vegas at the meeting. It was, as I said in the beginning, it was my second time. So I I really applaud the women that were there for embracing the men that were there,
Hmm.
which I think was super cool. And I do think that there's a place, particularly from a mental wellness perspective, to be able to be around other like-minded or like-journeyed people, which in this case would be women, to help support one another in ways that men will never understand. So I think it was great. It doesn't look like anything is slowing down. Women in DSO in particular. President of the ADA was there and addressed the audience as well. So I think it's a really good thing. And I also think, as I meant to say this earlier, the not just for the women dentists, but I think for the women in corporate, this was really quite helpful and in some ways groundbreaking because in many ways they don't have anyone to talk to. And maybe within their own corporations, there's that competition or women and women thing that you were referring to earlier. In this way, a senior executive at, whatever company can commiserate with a female executive at a different company in a way that is, certainly non-threatening, of course, but in a way that could be even more mutually supportive. So,
Yeah, and my final thoughts would really be to our female clinicians out there is use Martin and I as a scapegoat. So
yeah.
if you're ever feeling challenged and you're worried about being perceived as complaining or, oh, you just can't take it, kind of thing,
Mm.
use like, hey, there's these two weird guys that I listen to or, I watch on Instagram and they were
Yeah.
talking about this. And, is this something that you've gone through that patients have said this to you too? And I think you'll be well understood by other female colleagues. It just takes someone to kind of bring it up. So
Yeah.
once you bring it up, I know when Martin and I have brought it up in courses or masterminds or online stuff, there's always so much support and
Yep.
so much thank you for talking about this because
Yeah.
I've been suffering in silence.
Hmm.
And so that would be my advice that I would have for any of our colleagues too is use us as a resource and as really like a scapegoat of, oh, send this episode to
Yeah.
somebody or some resource that Martin and I have posted about this, I think can really help spread the word. That's why
Yeah.
we did this. That's why we've added this to our courses. That's why we've done all female events. And, we're even potentially working with Glidewell soon. They have an all-female group, and we want to bring light to this so that we can figure out how to solve these problems. That's
Yep.
that's what it is. But the first one, like any problem, is self-awareness
Hmm.
and general awareness within our
Yep.
profession.
100%. 100%.
So if you want to join us in May on May 9th and 10th for our Lightside Live event, we will be talking about some of this discussion, and some of this
Hmm.
discussion does come up in
Yep.
our live event. Go to wellnessanddentistry.com, click on links, and you'll find the links to our live event. And if this episode really resonated with you and you've got a colleague, male or female, that needs to listen to this, we'd love if you would share that and maybe even write us a nice review. And thanks always for the support, and we'll see you on the next episode of Wellness and Dentistry.
Bye bye.